Battling COVID-19 can be scary. Being alone while battling COVID-19 can make it even scarier. Ashley Sampson is taking a look at the impact that isolation is having on mental health.
At Leanne Miller's home,
Come on, get up here.
the cats outnumber the people.
My house is a cat toy. There's cat toys everywhere. Mwah. They're my lifesavers.
A one-eyed rescue and another who's not so sure about all this camera stuff. But for Leanne, the last few months have gone to the dogs.
I got tested, and 2 days later, lo and behold, I had a positive test, and I was shocked.
She says that shock gave way to an avalanche of miserable symptoms.
You got hit hard. Like it was a really bad sickness for you.
It was the body aches and the headache that wouldn't stop.
Even now, more than 2 months later, the effects still linger.
I'm so sorry, I'm out of breath.
Even simple tasks leave her gasping for air.
I wasn't like this before.
Sure, COVID-19 has been tough physically, but she says the emotional toll is far greater.
The isolation, that was absolutely the worst for me. We're a social society, and to be cut off from everybody I felt like a leper.
When you think that there's so many Americans out there right now that are going through what you went through, the isolation and fighting COVID alone, your heart must just go out to them.
Yeah, it's awful. I really wouldn't wish it on anybody.
Weeks spent in bed with just a window to the outside world.
That's the window I would wave to people out of. Like, hi, how are you?
She says without her furry friends, she wouldn't have been able to cope.
I don't know what I would have done without my animals, because they were a living, breathing thing in my house.
Now, as life slowly returns to normal, she has some advice to those fighting the virus without help.
Reach out to people if you get COVID and you're alone. Reach out to people and ask for help.
I'm Ashley Sampson reporting.
The concerns some healthcare workers have about the COVID vaccine. Next.